Good morning, everybody. I hope you all are having a good day. I just wanted to take a few minutes and kind of turn in a different direction from the uh, critiques that we've been doing. We all know now that taking x rays is more than just point and shoot, right? There's a lot of different steps that are involved and a little bit of thinking that needs to take place. So I figured I'd put together, 10 steps for taking a quality x ray. And we're just going to run through those real quick. Maybe there's something here that you hadn't realized or need a refresher on the steps that we need to take in order to get a quality x-ray. So we're just going to run through these real quick. I appreciate you watching this. And let's get started. So first of all, number one, uh, verifying the patient's identification. This is critical. It is not as critical as in, say, a big hospital where we're in a fairly small setting and we're doing one patient at a time. It is important that we have the right patient and we are very clear on what body part we are x-raying. Uh, just make sure we've got the right patient, right body part for every uh, x-ray study that we do. Okay. This is very important. Number two, explain the procedure. Okay, we need to clearly explain the X-ray procedure to the patient to reduce anxiety that they may be having, and to ensure the patients are on the same page. Explain breathing expectations and the importance of holding completely still. Uh, for me, it's important, and you'll notice a big difference if you do this. If you'll be upfront with the patient, let them know that what you're going to be doing, and if they're going to take a breath in, blow it all the way out and hold it, or just hold their breath, or just hold still. If they know that ahead of time and know what's expected of them, uh, your X-ray series goes a little bit better, and your images will be better as well. The importance of holding completely still, if they have that in their mind going into the study, it's going to make a big difference on the study that you get on the other end. So yeah, just be open with your patients about what you're doing and and what you expect out of them. Um, so proper positioning. We do talk a lot about positioning. Positioning is extremely important. It's more than just getting the body part in the frame, right? There's different angles that are used so we can see certain parts of the anatomy that we're looking for. Uh, Pretty big deal. Position the patient correctly according to the specific anatomy being imaged. If immobilization is necessary, we use it, whether that be a family member that is not pregnant to help hold a child. Just make sure they're holding that child in the correct projection before we take the image. Uh, but yes, very important for positioning. And I threw in as far as positioning goes to ensure that a marker is used, whether it be right or left, just for proper identification of that body part for those that weren't there when the image was taken. But yeah, proper positioning, get to know your positioning, watch the videos that I put out. Um, it's pretty cut and dried as far as the views that we do on most things. Just learn how to do those views very well, and you'll be just fine. Minimize motion, very, very important. We talked about the patient holding still. Instruct the patient to hold extremely still during the exposure. Uh, this as well as breathing techniques. You want to make sure that you take your images when that patient is holding their breath and holding still. Okay, it's going to make a big difference in the images that you produce. If there's any movement, you're going to have blur uh, on your image, or it's just not going to look right. And it definitely won't be as diagnostic as it should be. So, very important that our patients are holding still. And I know this is really hard with kids sometimes. Some sort of immobilization system needs to be used. Most of the time, it's us or a family member. Just make sure that those family members are all let it up so we protect them. It's important that the patient holds still in the right projection. Okay, it's going to make a big difference in the type of image that you get on the other end. Uh, no motion equals a clear picture usually. So, uh, number five, collimation. I know I talk about collimation a lot. Collimation is very important. Uh, it's imperative to restrict the X-ray beam to the area of interest, right? The reason we do that is first and foremost to restrict scatter radiation, which can harm the patient and also makes a big difference on our image. Scatter radiation can make your image look pretty crappy. So just remember, the more we collimate, the better our image is going to be. That being said, you need to make sure that you collimate to the body part and not cut any of the body part off. Um, it takes practice. Uh, the more you collimate, the better your image is, and that's the bottom line. So yeah, practice your collimation. Make sure you're getting the body part you need on the image, but collimating as tight as you can. Okay. Number six, exposure factors. I know this is a holdup for a lot of people. Most of our machines are pretty set up as far as exposure factors go. So it's basically choose your body part and shoot that technique. There are various times where you have to change that. Your mask setting usually, your KVP usually stays the same, pretty constant, where your mask goes up and down depending on the size of the patient. Adjust your exposure factors according to the body part and size of the patient. This is important in achieving the desired image density and contrast. Okay, don't freak out about exposure factors. Okay, like I say, most of the time you're going to be use what's preset in the computer. If you ever have any issues with that, just give me a call and I can get you in the ballpark if it's a really big patient or a really small patient. I did do a class on this. Feel free to look back on that. It would be helpful for you. So here I have ensure that the KVP and mass settings are appropriate. Also, proper focal spot settings. We have a large and a small focal spot. Just remember, if you're doing extremity work or anything, smaller, you're going to use a small focal spot. It's going to give you a little bit better picture. It streamlines the X-ray beam a little bit. Give you a more diagnostic image. So yeah, proper focal spot setting is important, and we did talk about that in that same class as well. Number seven, radiation protection. When appropriate, use lead shielding for patients or anyone in the X-ray exposure area. Yeah, use lead. If the patient wants you to cover them up, cover them up. If you're doing a children, pregnant women, or women of childbearing age, try to use a lead shield. Okay. You may feel or may not feel that it's appropriate, but you're protecting that patient. And if you're in there helping to hold a child or an elderly adult, put a shield on, protect yourself. Because as radiation deliverers, we do get exposed to a fair amount of radiation. So it's important that you protect yourself and protect your patient. Okay. Number eight, processing techniques. So use of proper post-processing procedures like windowing and leveling of an image is very important. Okay. We want to make sure that image looks as good as it possibly can before the doctor or the radiologist sees it. Become familiar on how to window and level an image, and most of the time the image that comes out on the computer screen is adequate and is diagnostic. There are times when an image comes up really dark. You can lighten that up with post processing. And you don't have to do a retake. The only problem you run into is if your image is really light, you just don't have the information there to window and level that image. So most of the time when it's underexposed, you're going to have to retake the image. But yeah, learn how to use post processing. It's basically a right hand click on your mouse and drag until you feel like the image is diagnostic. And like I say, most of the time, the image that you come back with is going to be diagnostic. Okay, but uh, yeah, practice with post processing. You can pull up any image on your system. You can practice making that image look good, bad. I suggest that you do that. Um, so number 9, image evaluation, which is the series I'm doing now. It's really important to assess each image that you take and make sure everything is there that needs to be there, and that it's diagnostic, and that it's aesthetically pleasing. Okay. We need to make sure that those images are annotated correctly. So, if it's a hand, finger, wrist, forearm, make sure it's hung from the fingers, as well as feet hung from the toes. Uh, just make sure that that image looks anatomically correct, right? We don't want any unwanted rotation or distortion on the image. And that all comes with image evaluation. So, number 10, repeat the image if necessary. Okay. If you have an image that you cannot make look good, or we've cut anatomy off, or there's motion, or there's graininess due to underexposure or overexposure that you can't fix post processing, retake that image. Okay. The reason we're here is to put out diagnostic images. Okay. And if that image isn't diagnostic, it doesn't do anybody any good, and it's a disservice to the patient. So, evaluate your images, make sure they look okay. If you have any questions, ask somebody. Uh, ask the provider on duty, does this look okay, or do you think I need to retake it? Yeah, don't be afraid to retake an image if it is subpar quality. Okay. Um, but yeah, if it can't be corrected post processing, and then it's necessary to retake the image. That being said, we want to be careful not to retake so many images that we're overexposing the patient. That's where the previous steps come in: proper positioning, proper collimation, proper exposure techniques. If you can get those ducks in a row, usually your end product is going to be pretty good. So, for me, I just feel like that we need to practice. If an X-ray comes across, don't hide from it. Jump in there and give it a shot. And the more you do it, the better you're going to be. And I'm of the opinion that practice does make perfect. So just take these 10 steps and use them with every patient that you do. Make sure those images are, are looking good and diagnostic. Okay. Oh, I hope you enjoyed this. Something simple, just 10 little steps that we should go through with each patient. And if you'll do that and really pay attention to what you're doing, your images are going to be diagnostic, and it's going to be uh, much better for your patient as far as diagnosis goes. So, anyway, if you have any questions, reach out to me. We'll see you next week again for another evaluation series. It's going to be chest X-ray this week. Uh, so I appreciate you being here. I appreciate you watching. Keep working hard. You guys are doing awesome. So we will talk to you very soon.